Our understanding of the neurons have led to very exciting development of drugs that have been used to influence neurotransmission. Through these, we aim to fulfill the role of psychologists, which is to help improve the lives of people. And so we hope that more understanding of this would help us develop even more effective treatments for individuals with fewer side effects. Most of the methods that biopsychologists use to study behavioral effects of neurotransmitters are pharmacological, meaning involving the use of drugs. To study neurotransmitters and behavior, drugs that have a particular effect on particular neurotransmitters are administered to subjects. And these are the 7 steps that are seen and observed in neurotransmitter action. You can see that the first step here would be the neurotransmitter molecules are synthesized from precursors under the influence of enzymes. The enzymes would be these red coily parts in here, whereas the neurotransmitter precursors would be here. Step number 2 would involve the neurotransmitter being stored into a vesicle. From there, if they leak out, then enzymes can actually destroy them, as we saw in the previous module, through degrading them. If they're maintained in here, then they are protected by them. Action potentials, if there's one that's evoked, then it would cause a vesicle to fuse onto the synapse of the membrane here. See, this would then transition from here, bind to the membrane, and once bound, then it would open up. And if it opens up in here, then the neurotransmitter would be released, and it would bind with autoreceptors and inhibit the subsequent of neurotransmitter release. So they would not allow for more of this to be released. Then the neurotransmitter molecules would bind to the postsynaptic receptors, and the released neurotransmitter molecules are deactivated by either reuptake or enzymatic degradation, as we saw in previous slides. Please take the time to look at this picture, and you should be able to recognize every single part of this terminal button, and you should be able to understand the role and explain it to yourself simply. If this does not make sense, please be sure to look back through your notes or email me with any questions. We have 2 main drug effects. We have agonist drugs, which basically increase or facilitate activity. These are stimulants or uppers. An example of that would be caffeine, as it is one of the most common substances. Antagonists would decrease or inhibit activity, and that would be an example of a depressant or a downer. And the most popular of them all would be alcohol, because of its legality. Please note that a drug may act to alter neurotransmitter activity at any point in its life cycle. And the life cycle of the drug depends on various factors such as dosage and also the organism in question. For example, I'm quite sensitive to caffeine. I do not metabolize caffeine well. For some individuals, they're able to take coffee and multiple coffees per day. If I were to take a coffee, it would make me quite jittery, and that is something that's a very personal thing because of my metabolism. So please note that the drugs that can alter neurotransmitter activity depend on the life cycle, but the life cycle depends on the individual and the dosage. I'd like you to spend some time looking at this picture and understanding what the mechanisms of the drug action are, depending on whether it is an agonistic drug effect or an antagonistic. Please note that with the antagonistic drug, which is on the right side of the screen, we find that, as you may remember, this is a downer, this is depressant, and the drug would block the synthesis of neurotransmitter molecules by destroying the synthesizing enzymes. The drug also causes the neurotransmitter molecules to leak from the vesicles. That way they could be destroyed by the enzymes in here. Additionally, an antagonist drug, the drug would block the release of neurotransmitter molecule from the terminal buttons. It can also activate autoreceptors and inhibit neurotransmitter release. And we know that the drug would be a receptor blocker, as it binds to the postsynaptic receptors and blocks the effect of the neurotransmitter. This would be an antagonistic effect in which we would inhibit the likelihood that the neurons would fire. These are depressants and downers. An agonistic drug, which is a stimulant or an upper, which increases or facilitates activity, we see that the drug increases the synthesis of neurotransmitters, basically by increasing the amount of the precursor. It also increases the number of neurotransmitter molecules so that we can withstand and avoid the degrading enzymes. The drug would then increase the release of neurotransmitter molecules so that it could fire more. It would also bind to autoreceptors and blocking their inhibitory effect on neurotransmitter release. The drug binds to postsynaptic receptors and either activates them or increases the effect on them. Eventually, the drug blocks the deactivation of neurotransmitter molecules by blocking the degradation or reuptake, allowing for the drug to continue its effect of increasing the likelihood of making neurons fire. Previously, it was believed that there was one kind of receptor for each neurotransmitter. We now believe that the drugs are selective to specific receptor subtypes, and they may exert different effects. We'll be looking at acetylcholine receptors and how they bind to nicotine, whereas others bind to the muscarine, and looking at the effect that this would have on behavior. So we'll be looking at 3 influential lines of research in behavioral pharmacology. 2 of the most popular receptors are nicotinic and muscarinic. These are distributed differently in the nervous system and have different modes of action, and consequently have different behavioral effects. Please note that both receptors are found in the CNS and the PNS. Looking at the first receptor, the nicotinic receptor here, we're going to be focusing on the PNS, peripheral nervous system. We'll be looking at an example of tobacco and also, more interestingly, at curare, which is an extract of wood vines from South America. Now please note that in the PNS, nicotinic receptors occur at junctions between motor neurons and muscle fibers. And we find that these make use of what we call the ionotropic receptors. Ionotropic receptors basically induce immediate, shorter lasting, and more centralized effects. And the perfect example of that would be the example of curare. Now, South American natives have used curare, which is an extract of a certain class of wood vines, and they've put on the tips of arrows that they use to kill their prey and occasionally also their enemies. Although I don't know that this was used specifically with this intention in a movie. The Ace Ventura, When Nature Calls, the second movie, there is a scene where Jim Carrey is running through and he is shot by Indians, and these tips of these arrows seem to be paralyzing his body by the minute. And again, I don't remember this movie saying that it was curare, but it appears to be quite accurate in what they do. Curare is a receptor blocker from a cholinergic synapses, and it acts on nicotinic receptors, which is what we're looking at here. By binding to nicotinic receptors, curare blocks the transmission of neuromuscular junctions, and it paralyzes the recipients, killing them by blocking the respiration. It is sometimes administered to human patients during surgery to ensure that their muscles do not contract during an incision. When curare is used for this purpose, the patient's breathing must maintained artificially by a respirator, as it can also inhibit breathing. Here you can see how binding to the ionotropic receptors would bring about the characteristics stated earlier, which is an immediate response, it lasts temporarily, and it's also very centralized, meaning it would have an effect specifically in the area where impacted. The muscarinic receptors are basically, when we look at muscarinic, we talk about mushrooms, the poisonous substance that is found in some mushrooms. We're going to be looking at the effect that this has and how it goes from the PNS, peripheral nervous system, and affecting specifically our autonomic nervous system. Now, this would bind to the metabotropic receptors, which have unique characteristics different from the ionotropic receptors. These, instead of inducing an immediate response, they induce a lower response. Instead of having a short effect, they're longer lasting. And rather than being centralized, they're a lot more diffused and more varied effects. And so we look at marijuana being one of the examples for this in here. Whereas with marijuana, we could see that individuals would have a diffuse and varied effects, where some individuals may feel relaxed, some individuals actually feel quite anxious. There are some individuals hallucinate, there are some individuals that do not. And the effects are felt in a more generalized form with varied effects, including appetite and relaxation. The discovery of endogenous opioids, basically painkillers that our body produces, has provided insight into brain mechanisms of pleasure and pain. Generally found in the hypothalamus and other limbic areas, this is the most concentrations found in the PAG or periaqueductal gray brainstem area. In fact, we have found that microinjection of morphine into the periaqueductal gray area, or even electrical stimulation of the PAG, produces strong analgesic effects. We also find the effects of dopamine agonist and antagonist on psychotic symptoms have led to the development of treatments for schizophrenic individuals. And this is based on the dopamine excess hypothesis, which claims that the positive symptoms in people with anorexia, which are the hallucinations, visual and auditory, are brought about or produced by an excess amount of dopamine. So by creating dopamine agonist or anti-dopaminergic agents, we're able to diffuse the effects and control the positive symptoms on these individuals. Please note that this does not cure schizophrenia. It simply allows for the sedation of the hallucinations that they sometimes experience.